Taxing sugar-sweetened beverages to prevent and reduce obesity in school-aged youth. Sugar-sweetened beverages are drinks that contain added caloric sweeteners. These include soda, fruit drinks, sport drinks, teas and coffee, energy drinks, and sweetened milks. SSBs are an issue because they account for the largest source of added sugars in the diet of American youth. And this is a public health problem because we believe that it's related to obesity and obesity-related diseases that have increased in children. Obese youth will likely become obese adults with a number of health ailments. Obesity-related complications not only affect the lives of the individual but also put a massive burden on the U.S. economy. Obesity-related diseases cost the U.S. economy $147 billion per year. The United States Department of Agriculture recommends daily sugar intake should be between 6 and 10% of a child's total energy intake. On average, children in the U.S. consume twice this amount. Sugar intake as a percentage of dietary energy among adolescent males and females is approximately 20%. Among children aged 2 to 5 years, sugar intake accounted for 16% of total energy, while children 6 to 11 years have a mean sugar intake level of 19%. Sugar-sweetened beverages are the main source of added sugar in the diets of school-aged children. Here's a graph published by the CDC that looks at the trends in beverage consumption over the past 20 years in persons aged 2 to 18. What we see is a sharp increase in the consumption of SSBs, especially after 1994, and also showing replacement for milk with SSBs as the primary caloric beverage consumed by American youth. The above graph illustrates the need for drastic prevention of childhood obesity. Focusing on the blue and green lines representing school-aged children, we can see that since 1980, the percent of childhood obesity has more than tripled. Rates of childhood obesity in school-aged children is roughly 17%, or 12.5 million U.S. children today. For the first time in the modern era, adolescents are now expected to have a lower life expectancy than their parents. The Bradford-Hill criteria for causal inference were used for evaluating evidence to make decisions about the association of our exposure with our outcome. Here we explore temporality. The question we've asked is, does consumption of sugar-sweetened beverages lead to development of obesity? For temporality to exist, the exposure should exist before the disease can occur. In our literature review, we looked to see if intake of sugar-sweetened beverages took place before the occurrence of obesity. To study this assumption, we looked at 9 cohort and experimental studies to determine whether the intake of SSBs influenced the incidence of weight gain, which is the causal pathway to overweight and obesity outcomes. While consumption of SSBs is not the only factor needed to influence the outcome of obesity, with the exception of one study, there were not statistically significant differences in weight status and weight gain of children who consumed SSBs versus those who did not. Here we looked at the biological plausibility. In other words, is there a biological basis for understanding the association between SSB intake and obesity? And there are a few theories behind why sugar-sweetened beverage intake may lead to obesity. One is the fructose argument, because as many people know, high fructose corn syrup is often used in sodas, which are the primary source of SSBs in adolescents, which has a 55% concentration of fructose versus 45% for glucose. And fructose bypasses normal regulatory systems where glucose is utilized. According to some studies, fructose is poorly digested, and fructose is preferentially metabolized into fatty acids as compared to glucose, which may explain higher adiposity. So there's also an issue of the hormone leptin and insulin deficiency with higher percentage of fructose in the sweetener. What we see are lower levels of leptin and insulin secreted when a higher proportion of fructose is ingested, and this essentially leads to a reduction in satiation, as leptin is responsible for signaling to the hypothalamus that the body is full. So inappropriate satiation can lead to excessive calorie intake, and a byproduct of that is obesity. Recommendations made on Bradford-Hill criteria. We recommend a 20% taxation of SSBs, and this is per ounce of soda. Based on our literature review, the most common reason cited for failure of SSB taxation failures previously and other disincentive programs was insufficient taxing. Programs such as cigarette taxation in New York have been successful because of the high tax rates, which make their habit prohibitively expensive. Economist Michael McCarthy published an article in The Lancet on the economics of obesity in 2004, indicating that economics plays a large part in the epidemic of obesity. He simply states that if you want to change behavior, change the cost. Just telling people to stop consuming something will not have much impact. In an economic sense, those who consume SSBs and become ill do not bear the direct cost of their choices. The taxpayers and government do because they often must subsidize the medical care for these patients that often become lifelong sufferers of obesity-related diseases such as diabetes, hypertension, and heart disease. Given that Texas has the highest rate of uninsured individuals, we urge the legislature to levy this 20% tax not only to create a disincentive to the consumer, but also reduce the morbidity and mortality related to obesity, and as a result, the economic burden of rising healthcare costs. To this end, we suggest potential uses for the money raised in this effort to be used in schools to teach school-age children about proper nutrition and exercise, perhaps even bringing back a home economics style type class where children are taught how to make healthy meals, about vegetables and gardening, and how their choices may impact immediate and long-term health. To support our efforts, we ask the legislature to consider removing SSBs from school lunch programs as well, to show solidarity with the tax disincentive so children are not permitted unfettered access to SSBs at school without parental supervision. Our conclusion on this issue. Based on our systematic review of the evidence of SSBs in K-12 aged obesity, we feel that evidence is compelling for an association. Confounders such as lifestyle choices and sedentary lifestyle may skew the evidence given that physical activity would have an impact on calorie balance. However, we feel that based on biological plausibility and dose dependence, that there is still sufficient evidence showing that consumption of SSBs increase the risk of obesity in our target age group. As mentioned before, this would be a money-saving endeavor for the Texas state legislature in the long run, and would generate much-needed funds and potential reductions in indirect costs associated with healthcare expenditures. While we realize that other vehicles for sugar exist in processed food, we feel that lack of nutrition in SSBs makes not only the biggest culprit in excess sugar consumption, but is the first line of defense against obesity in our youth. While the American Beverage Association may resist this policy based on business interests, it must realize that passing off indirect costs to human health and healthcare for its own business success is unethical and should not be permitted in a country with an obesity epidemic that is crippling our citizens. A visit to the ABA homepage will show consumers and legislators alike that these companies are aware of their products' impact on health, and our policy change is designed to create consumer awareness about what kind of beverage they're consuming and how much they consume. Thank you for your attention, and we hope you found our presentation enriching and convincing that we need a change in the state of Texas.